Hello everyone, this is Shinamol Nair, student of Roman University, class Special Issues and Trends in Nursing. I named my project as Healthcare Reform and APN Practice. As we all know that the Affordable Care Act came into a law a decade ago. So this student wanted to investigate more on how it has affected nursing. Healthcare reform assures that all Americans are provided the opportunity to get quality healthcare, specialized services, reduce the cost of healthcare, and establish managed care. Even though it came into a law in 2010, for years it has been on the talk. In 1994, Mr. Cutler listed four rationales for healthcare reform: increasing the efficiency of health delivery, reforming the market for health insurance, providing universal coverage, and reducing the federal deficit. As we all know that President Barack Obama signed the Affordable Care Act in 2010. After 6 years, he analyzed how the act has affected the healthcare system of United States. He says it improved the development of affordable, high quality, and accessible healthcare systems, reduced the number of uninsured Americans. According to him, in 2010, 2011, there were 49 millions of Americans who were uninsured, but it has reduced to 29 millions in 2015. And next one is expansion of preventive services and then establishment of a value-based payment system. Instead of the traditional payment system, the Affordable Care Act changed the way of getting paid for the services provided by providers and healthcare institutions, and lower at the last lower healthcare cost. Let's have a look at the problem in the United States. Many countries have secured the right to health of their citizens by the establishment of universal healthcare system, highly dependent on public financing, closely integrated with public health systems. But in the United States, healthcare remains as an economic good through a fragmentary system of public and private coverage subsidized to varying degrees. So we all know that we face this problem, especially in recent time because of COVID-19 pandemic. So this the lack of public integrated public health system created problem in tracking the cases, identifying the cases. So it's very important to have an integrated public health system. So now let's see the impact or the significance of healthcare reform to nursing practice, especially to advanced practice nurses. APNs are highly skilled professionals who have cleared the national certification exam. Only 12 states permits APNs for independent practice. Healthcare reform demands accessibility of quality healthcare to all Americans. More Americans will be accessing primary and preventive care services, which will be worrisome for already strained primary care providers. So as we all are in the same, class for masters in science, either it will be in a family nurse practitioner course or acute care practitioner, different areas are there. But we all are trained in masters in science, and there are a lot of APNs out there who has doctorate degree. So we all are, highly qualified professionals to provide care to the patients. And unfortunately, only 12 states in the United States permits APNs for independent practice. And according to the healthcare reform, more Americans will be accessing preventive services, and it will be a strain to already strained primary care providers, because there is shortage of primary care providers in United States. Now, let's see some research findings. So, according to Brom and his colleagues, the study was done in 2018. The Affordable Care Act impacted APN's practice, and 8 states have adopted full practice authority from 2011 to 2016. That is happy news that more states have adopted. They are allowing APNs for the independent practice. And 7 states embraced Medicaid expansion and ongoing argument for full practice authority to meet growing healthcare demands. So, this argument between nursing leaders and politicians should take place to have APNs for the full independent practice to provide efficient services to the public. And now let's see the my applicability of my project to my anticipated career trajectory. This student's goal is to become an acute care nurse practitioner to improve the patient outcomes through comprehensive care, collaboration with other team members, establishing clinical pathways, education, and participating in research to advance clinical medicine and provide quality and efficient care to the patients. So the student has listed some points of significance of healthcare reform to the practice of APN as an acute care nurse practitioner. So first one, value-based payment models increase the role of APNs in acute care settings. APNs are able to provide holistic care through patient and family-centered care, and we all know that physicians lack in this area, and nurses excel in this area. So that quality can be utilized to provide holistic care to the patient and family. APN's practice is based on evidence-based practice. So along with the evidence-based medicine, nursing also focus on evidence-based practice. APNs are able to collaborate with other team members to meet the needs of the patient. So in nursing itself, as a bedside nurse also, we work with other team members to provide comprehensive care to the patient. So that skill can be utilized in the practice of advanced practice nurses too. APN service can be utilized to reduce the disparity in healthcare delivery. We all know that across United States, some ethnicities, some areas, they they don't have access to the healthcare. So utilization of these highly skilled professionals can reduce the disparity in health delivery in United States. APN's practice is a global trend. When we look into other countries, other European countries, Canada, Australia, all these countries, APNs are acting, functioning as care providers. So it's a global trend. APNs can contribute well in primary and preventive care services. Much work needed to be done to obtain full practice authority for APNs. So so far we have came a long way, but much work needed to be done to obtain full practice authority in many states. Now let's see the conceptual framework I have chosen for this project. Managed care model is the conceptual framework suitable for this project. The interprofessional care model with the different disciplines around one patient is well coordinated, which can be concurrently or sequentially delivered to improve the coordination of diagnostic, therapeutic, and rehabilitative approaches between disciplines. Areas for future research. It is very important to provide scientific evidence to prove APN's role in contributing to the changing healthcare world. Research should be undertaken to show evidence that APNs have an integral part in providing comprehensive care to the public. So, Even though much work has done in this field, we need to prove that APNs have an integral part in providing comprehensive care to the public. So I would like to list two studies which are conducted to prove APN's practice. Mayers performed an exploratory study to identify APN's role as healthcare clinician for improved clinical and preventive services. The study was done in 2009. The data was collected from APNs from 3 practice settings and 6 nurse members from the US Services Task Force. The study concluded that APNs are positioned to provide a new brand of comprehensive healthcare which starts with conventional medical practice, but it goes well beyond that. And the second study is Whaleman and her colleagues conducted a quantitative analysis on patient satisfaction with the quality of counseling provided by advanced practice nurses specialized in multiple sclerosis. This study was conducted in 2021, and the study found that the patients rated the counseling provided by APNs as of high quality. So these two studies prove that APNs are positioned high in a high level to provide care to the patients in all levels. So let's discuss more about more about my project and what has to be done in future. So when President Barack Obama signed the Affordable Care Act into law on March 23rd, 2010, it fundamentally laid the foundation for the future of healthcare in America. The Affordable Care Act supports the development of high quality patient centered care, which is accessible to everyone. It is very important to utilize the expertise of advanced practice nurses to meet the demands of the Affordable Care Act in the scenario where there is shortage of primary care providers. Independent practice of APNs will aid the public to access quality care. Statewide, major legislative changes are essential to allow advanced practice nurses to have the practice authority in all states to have a universal health delivery system which focuses on preventive care and health promotion. I hope this was an informative presentation for all of you. Um, um, I feel much work needed to be done in this field, and um, the nurse leaders and the politicians and other health care members should come into agreement to see what the quality, the qualification of APNs can be utilized in various settings across the healthcare system in America. So next is references. When I started searching the literature to find information, there were tons of literature out there related to this subject. So I have listed most of the resources that I have used for this project. I hope you all enjoyed my presentation. Thank you.